It's a big killer in our country, a killer that is preventable. We're talking about infections caught by patients in hospitals.
The federal government is cracking down on hospitals that rank poorly when it comes to infections. Some of Portland's biggest hospitals are being docked money in part for having too many patients catching infections. KGW investigative reporter Wayne Haverly has been digging into this deadly problem. Wayne?
Yeah, you know, a CDC report estimates that 100,000 people, think of that, almost 100,000 people die each year from infections that they catch in hospitals. And some of the hospitals that are being dinged by the federal government for not performing well in this area are some household names around Portland. We're going to get to that in our investigation coming up at 6. And during that investigation, we talked to a lot of infection victims, and that include Carabelle Hubbard, whose husband died 2 weeks ago in a local hospital. He caught C. diff. That's a serious bacterial infection, and he caught it following heart surgery. He never did make it home. She claims doctors told her not to worry about that infection, and she feels that she was made to feel a bit uncomfortable whenever she tried to ask questions about it.
It's almost like you can't question the people who are telling you what they're going to do to save your life.
Fortunately, tonight you can ask all the questions that you want. We have an expert in hospital safety here with us. This is Dr. Loretta Krautscheid. She's with the University of Portland Nursing School, and she's been here answering just an amazing amount of questions. She's been answering them since 4:30. Some fantastic questions. Which infections are the most dangerous? What kind of infections are common in hospitals? Does this mean home births could be safer than going to the hospital? All kinds of questions. She's answering them. She'll be doing that until 5:30 tonight. And then after that, of course, you can go online at KGW. You can read through all these great questions and her answers, and you can learn a lot from that. And then our investigation is coming up tonight at 6 o'clock, and we will see you then.
This is KGW News at 6.
Hospitals are supposed to be places you go to get healthy, but what happens when the hospital makes you sick?
The federal government is asking that question and cracking down on hospitals where patients are getting too many infections. KGW investigator Wayne Haverly has been digging into that process and the big penalties for hospitals with poor performance. Wayne?
So how big is this problem? Well, check this out. Check out these numbers. According to the CDC, 2 million people get these infections while they're being treated in U.S. hospitals every year. And out of the 2 million, they estimate nearly 100,000 of them die every year. Well, now under the Affordable Care Act, some of the worst performing hospitals are being dinged financially, and that includes some of the biggest hospitals right here in Portland.
I'm angry about the whole thing.
Carabelle Hubbard's husband, Bing, died just 2 weeks ago. He went into the hospital to replace a heart valve, but somehow caught C. diff, a bacterial infection, and he never made it home.
They didn't explain it to me. They didn't say how dangerous it was or anything about it, just that he had it.
They had to cut over the top of the original incision.
Brian Little caught a bad bone infection following knee replacement surgery, and he's been out of work trying to heal for nearly 8 months and continues to take strong antibiotics.
I kept expecting it to get better, and it didn't, so finally, they drew fluid out of it and said, yeah, you got a real bad staph infection.
Unfortunately, these are not unusual cases. Now, to get a better handle on conditions that are caught in hospitals, the federal government just started docking hospitals 1% of their annual Medicare payments if they fall in the bottom 25% in this area. And for big hospital systems like Legacy, that can add up to millions of dollars a year.
Some of Oregon's largest hospitals are being penalized, including 3 Legacy System hospitals, Emmanuel, Good Samaritan, both in Portland, and Mount Hood Medical Center in Gresham. So are Providence St. Vincent in Portland, Mid-Columbia Medical Center in the Dalles, Sandy Am Hospital in Stayton, and Silverton Hospital.
We take it seriously.
Brian Terrett with Legacy Health says Legacy has already taken several steps in the past year to reduce hospital-acquired infections, and that big hospitals with trauma centers could have higher numbers because they serve higher-risk patients.
Are you saying then that being in the bottom 25 is acceptable because it's misleading?
I wouldn't say it's acceptable. I think any hospital-acquired infection is unacceptable. So What I can say is that we're really working hard to improve infections, and that we're going to continue to work within the system, and we're confident that the next time the numbers are reported, we'll be out of that bottom 25%.
Officials with Providence St. Vincent say we are constantly working to improve our performance in all patient safety metrics. We see our data long before they emerge in reports like this and take immediate steps to improve. Officials at the smaller hospitals believe the hospital-acquired condition scores are unfairly skewed against them. They say the only reason the percentages of infections look higher for them is because they have fewer patients. The infection problem does not surprise medical malpractice attorney David Wagner. He hears from at least 4 infection patients and families every week.
The vast majority of the time, we tell them we're sorry, we can't help them, simply because obtaining the proof from the hospitals to base a claim on behalf of a patient is almost impossible.
Now, if it's so difficult for attorneys to get information, how can a consumer make a good choice when it comes to finding hospitals with the lowest infection risk? Diane Waldo with the Oregon Association of Hospitals and Health Systems maintains there's plenty of information out there for consumers.
You know, take a look at the data from a hospital. Ask questions. I mean, hospitals are very much willing to provide data and information.
They are?
Yes, they are.
That's not what I hear.
You just ask.
So you're saying that hospitals are willing to provide all this infection data if you ask?
Well, okay. So the state has a public report of hospital infection data. That's out there for everybody to see.
Oregon does have a report from 2009 to 2013 on healthcare-acquired infections, although this 100-page report might not be easy for the average patient to comprehend.
It took an element of trust away.
Carabelle Hubbard wants hospitals to be much more transparent. She points out her husband's death certificate makes no mention of the C. diff infection he battled in his final days. The official cause of death? Respiratory failure.
We were a happy couple and we had good times and laughed a lot. And I think I was robbed and he was robbed.
Well, that's heartbreaking, definitely. Wayne, I guess the bottom line is, though, sometimes you have to go to the hospital, and you're glad they're there.
Yeah.
But how do you keep from getting one of these? What do you do?
Well, you have to realize first off that all the hospitals, even the hospitals in this report, they're all working very, very hard to improve their infection rates and that sort of thing. And in many cases in Oregon over the last couple of years, they've done a good job of improving in some areas, certain types of infections. But the best protection really starts with a dialogue, not being afraid to ask questions when you go in. I mean, we should always be concerned about infections. It is one of the highest risks in most hospitals. When you go in there, they will tell you that, and they will be very helpful, and you can work as a team to improve this. But really, it starts with getting the conversation going, and hopefully we've started to do that here tonight.
Yeah, well, once again, you have to be an advocate, right?
Yeah, absolutely.
All right. Thank you, Wayne. Now to a health alert. An outbreak of a deadly superbug. The victims were patients at the Ronald Reagan UCLA Medical Center in Los Angeles. 7 people were infected, 2 died. Hospital officials say nearly 200 other patients may have been exposed to the superbug. It's a drug-resistant bacteria known as CRE, and it was likely transmitted through contaminated medical scopes. It is the latest in a string of CRE outbreaks, and it has top health officials scrambling for some solutions tonight. KGW investigative reporter Wayne Haverly has been finding out more about this new superbug, and I guess we've seen it in Oregon as well as Washington. Wayne, how big of a problem, though, is it here in the Northwest?
Well, let's put some numbers on it.
Okay.
Here in Oregon, so far, 7 reported cases in Oregon. And in those hospitals, those patients did survive, which is actually quite unusual because this is a very deadly situation with this bacteria. Just last month, Virginia Mason Medical Center in Seattle reported that CRE linked to an endoscope there infected at least 35 patients and 11 died.
It's a mouthful, carbapenem-resistant enterobacteriaceae, which is CRE.
Dr. Chris Pfeiffer is an epidemiologist at Portland's Veterans Affairs Hospital. He's also working with the Centers for Disease Control to stop CRE from spreading in Oregon.
There are a couple of types of CRE, but the most worrisome one, which is one that can travel very quickly once it's put in a community or a hospital setting.
So far in Oregon, there have been 7 cases of the antibiotic-resistant stomach bug, but today we learn nearly 200 people may have been exposed from the latest outbreak at UCLA's Ronald Reagan Medical Center in Los Angeles. The infections are linked to infected scopes used to examine a patient's throat, stomach, and even small intestines. Sometimes the recommended sterilization is not enough to decontaminate the scope before it's used again.
I think this is kind of the new superbug, essentially.
Health and Human Services Secretary Sylvia Burwell says the CDC is offering its support to California to stop the spread of CRE, but she sees this as a long-term problem.
We need to do the research and put in place the practices that prevent this kind of resistance.
That's exactly what Dr. Pfeiffer is doing in Oregon. Right now, every VA patient gets tested for another superbug called MRSA, which is an antibiotic-resistant staph infection. It helps them track exactly where those superbugs are lurking.
We check you when you come in and right before you leave.
The VA system's focus on fighting hospital-acquired infections has been extremely successful in bringing down MRSA infection rates. Now some of the same strategies used to fight MRSA will likely be used to take on CRE, the latest superbug, which according to the CDC kills about 40% of the people it infects.
Now, in the past 3 years, there have been a half-dozen outbreaks of CRE, including that big one in Seattle we told you about, all connected to those contaminated endoscopes.
Well, that's alarming. How are they going to clean these scopes? What are they doing?
Well, right after that Seattle outbreak, which was announced last month, Patty Murray, the senator in Washington, she pressed the FDA to issue some guidelines for hospitals on how to better sanitize those endoscopes. The FDA says the devices are used on 500,000 patients a year, and they say just a tiny fraction of them report problems from dirty scopes.
Yeah,
but I think everyone agrees there should never be a dirty scope.
And you don't want to be the one,
yeah,
right?
Absolutely.
Because it's so serious. All right, thank you, Wayne. Tonight, KGW investigates superbug infections in Portland's VA hospital, and what we found may surprise you. The quality of care for our nation's veterans has certainly been under fire for those long wait times, but tonight we have some good news.
KGW investigators learned when it comes to protecting patients from deadly hospital infections, the VA is leaving other hospitals in the dust. Earlier this month, KGW investigative reporter Wayne Haverly exposed the hospital infection problem at local hospitals. Tonight, he shows us how the VA is tackling the deadly problem and winning. Wayne?
Well, Joe, infections caught inside hospitals have become one of our nation's leading causes of death, killing more people than car accidents and breast cancer combined. Even so, most hospitals only started addressing this problem seriously over the past 5 years. Many of them are starting to make some progress, but nothing like what's happening inside our nation's VA hospitals.
Hey, Robert. My name is Sarah. I'm going to be your nurse today.
11 days after being admitted to the VA hospital with a serious blood infection, Robert Fleming is going home. But first, he's being tested to see if he picked up a superbug known as MRSA before he goes.
I'm going to swab each nostril, and it just tickles a little bit.
Every single patient that comes in gets screened.
Yeah, on admission, they get screened. On discharge from the hospital, they get screened. And in between unit transfers, they get screened.
Dr. Chris Pfeiffer is on the front lines of the fight against hospital-acquired infections. 7 years ago, VA hospitals launched a focused battle against MRSA, an antibiotic-resistant staph infection.
And that is all.
Universal patient MRSA screenings are a big part of the effort.
If you only focus on patients infected with MRSA, so have demonstrated infection, then that's kind of the tip of the iceberg phenomenon, where you're missing patients that are colonized with MRSA.
Pfeiffer says less than 9% of incoming patients test positive for MRSA. While most are not sick, they are carriers, so the hospital isolates them and takes special precautions like donning gloves and gowns. And there's more.
This is the DAZO monitoring project, and we use it to educate our housekeepers.
Jennifer Holmquist is the hospital's infection control coordinator.
If they miss this surface, it's clear that they did miss it.
Holmquist was hired back when the program was launched, and every VA hospital in the country now has this same position.
We've also seen our MRSA infection rates drop approximately 75%. Over the past 7 years.
In this hospital?
In this hospital.
Wow.
A national study shows MRSA infection rates in VA hospitals plummeted more than 68% nationally from 2007 to 2012, a remarkable achievement when you consider infection rates were not dropping before the program started. Despite the success, the infection control program has had little impact on hospitals outside the VA system, where MRSA infection rates are going down as well, but the data just doesn't compare to the VA success.
I guess the advantage is that we have a huge system, 127, I believe, facilities that all implemented the same thing at basically the same time.
The VA gets a set amount of money each year, so healthier patients are better for the bottom line.
Clearly, the data shows that it works.
If it actually prevents infections, it's pretty easy to justify the cost of these things.
And each one of those screenings costs about $45. The VA has also started this program inside its nursing homes. Now the VA is broadening the program to include other superbug infections, including a deadly bacteria known as C. diff and CRE, which we just told you about yesterday after that outbreak at the UCLA Medical Center.